This is a passive range of movement assessment of the hip. Start with a passive straight leg raise, ensuring that you maintain knee extension as you move into hip flexion. We can then flex the knee as we move into hip flexion by taking the hamstrings out of the equation. We can then assess hip rotation by moving the patient's hip into 90 degrees of flexion and then internally rotating the hip, followed by external rotation. We can also assess horizontal adduction, followed by horizontal abduction. An assessment of hip adduction range of movement can also be performed with the hip in a neutral position by crossing one leg over the other and adducting the leg towards the midline. In a prone position, we can also assess hip rotation with the hip in a neutral position, assessing hip internal rotation, followed by hip external rotation. Hip extension range of movement can also be assessed by stabilizing the patient's pelvis and passively extending the patient's hip.